Shall I begin?
Yeah, please.
A very good morning. So today I'm here with a short presentation titled Eyeing the Impact Ocular Manifestations of Xeroderma pigmentosa. So as we all know, xeroderma is a rare autosomal recessive DNA repair disorder. It's caused due to damage in DNA due to ultraviolet radiation. And it may have ophthalmic, dermatologic, and neurological manifestations. Kaposi had first coined the term xeroderma to denote characteristic dry and pigmented skin. And as we know, this is a very rare disease with incidence of 1 in 250,000 live births. So there are 8 known subtypes ranging from XPA to G and XPV, which correspond to the 8 genes that affect in this condition. And the genes are usually involved in the nucleotide excision repair, due to which the gene gets damaged and results in all the underlying manifestations. So these clinical manifestations, generally, the patients present with photosensitivity, pigmentary skin changes, UV radiation induced damage to the eyes, cutaneous tumor development, and progressive neurological degeneration. So our study was conducted in the time frame between 2018 to 2024, and a complete ophthalmic evaluation of all those patients with xeroderma was done. So we could enroll a total of 30 patients with xeroderma. 17 were female and 13 were male patients, and the mean age of presentation was 21.9 years. So for the ease of analysis, we subcategorized these patients into 4 categories, so which we shall be discussing further. So the first category was eyelid abnormalities, and the most common abnormality we could find was ectropion in 4 patients and trichiasis and lid mass in 3 patients each, followed by entropion and symblepharon in 2 patients each. So the next surface abnormality we could find was photophobia, which was the most common presentation in 23 patients, followed by redness, watering, and foreign body sensations. So coming to the ocular surface abnormalities, it was surprising to see that the most common presentation here was ocular surface squamous neoplasia, which was present in 10 out of the 30 patients. Apart from that, we had punctate keratopathy and pterygium, which were the more common presentations. So this was one of our patients with bilateral OSSN. So in the right eye, the surgery was done, and the histopathological evaluation revealed conjunctival intraepithelial neoplasia grade 3, and in the left eye, the patient had invasive squamous cell carcinoma. So in our series, we could find 2 patients with invasive squamous cell carcinoma, and 1 patient had a concurrent nasal bridge squamous cell carcinoma as well. But it was very sad to know that it resulted in death of both these patients as they were lost to follow-up. So this is an interesting case series where we can see there are 5 siblings from the same family, and all of them had xeroderma pigmentosum. The first row shows the presentation in the year 2018, and the second row shows that in 2024. And we can see that the ocular as well as the skin pigmentary changes have increased over time. So this is another case wherein there are 2 siblings from the same family. The first row shows the elder sister, which she had a very dense corneal haze, and the second one is another sister. She had got symblepharon in both her eyes. So 7 out of the 30 patients had sluggish pupils, and 3 out of the 30 patients had abnormal extraocular movements as well. So 2 out of the 30 had some form of cataract, and 1 out of 30 had pigmentary retinal abnormality. So in conclusion, our study found a very large proportion of xeroderma patients with ocular manifestation. So there were almost 93 patients, 93% of the patients had ocular manifestation. So we should always keep in mind that these patients need a regular detailed examination by an ophthalmologist. They need regular use of UV protective sunglasses, use of lubricants on a daily basis, and urgent treatment and referral if any ocular disorders develop. So, in contrast to the popular saying that sunlight is good for you, but for xeroderma pigmentosum patients, it's always stay away from sunlight and save your sight. Thank you.
Thank you. It's a good presentation. Any comments?
Genetic counseling of these families?
Yes, ma'am, we have counseled them, but we couldn't perform genetic counseling because in Nepal, the genetic testing is very expensive. For one patient, it takes around 35,000, and it's very, they cannot afford that. But we are planning, if we can arrange some funds, at least for these siblings, we are planning genetic counseling, ma'am.
Okay,
you.
so, thank you.